So a seating assessment for a bariatric chair is not just about getting a wider chair. Now, this is a mistake we sometimes make. We think we need to look at the width of the chair, but that is only one very small dimension overall, because assessment of the bariatric client is quite a unique challenge. So accommodating a larger patient is not just about a wider chair. This client group have unique challenges in sitting and have unique body shapes that we must take into consideration when we're looking at their chair. Assessing these clients will almost always require at least 2 people in order to get it right. So what are some of the factors to consider in bariatric seating? So first of all, they have a reduced range of motion due to the mass of body parts. For example, legs and arms can be very heavy. The bariatric client may have difficulty repositioning themselves, and this can lead to pressure injuries, so having difficulty moving in the chair. They have an altered centre of gravity. Generally speaking, the centre of gravity is more forward in the bariatric client. Tilt and space facilitates a better posture for these clients while maintaining their function. Another challenge we have with bariatric seating is the bulbous gluteal region, which is excess buttock tissue. This reduces the ability to make contact with the back of the chair. If the gluteal region is not accommodated within the chair, the client is forced to sit in a posterior pelvic tilt, and this will cause sliding from the chair and back pain. This client group have increased risk of pressure ulcers or pressure injuries. They have greater skin weight. They have reduced vascularity and perfusion in the adipose tissue, and slowed or impaired wound healing. They may have a reduced mobility and a reduced ability to stand transfer. They may have breathing difficulties. A large number of these clients do not like to lie down and therefore are very dependent on their chair. In fact, some people, while we don't advocate it, some people would spend all day and all night in a chair because they're afraid of lying down. It's not advocated, but it's something that they may choose to do. So getting the chair right is imperative. Specific things should we be thinking about when we're seating the bariatric client? The arms should be removable if possible, for that's always ease of access for transfer and for applying a sling if the client is being lifted by a lifter or a hoist. An adjustable backrest will accommodate various body shapes, but in particular the bulbous gluteal region. And a back angle recline will accommodate someone who has limited hip flexion due to maybe increased abdominal tissue or maybe restriction in hip movement. Forward tilt on the chair will assist with the stand transfer. A lot of bariatric clients like to maintain their independence as long as possible. So with the forward tilt on the chair, we're able to achieve a standing position with more ease. Negative angle on the leg rest is also important to accommodate the legs. For when we want the person to stand up, we want them to be able to get the heels behind the knee so that they can do a forward transfer and a forward stand. So having a negative angle on the leg rest will assist with stand transfers. I believe that all the bariatric seating should have power adjustment. Number one, to give the client independence in sitting, because this client group have lost a lot of their independence in a lot of activities of daily living. And therefore, by giving them a handset and telling them that they can change their own position, they can maybe help themselves to stand up, it gives them back some independence. And also, if the client is being cared for, it's obviously much easier for the care for this client group. So I think power adjustment is essential for this client group. Tilt and space, we've talked about tilt and space before, and it applies particularly well for the bariatric client because tilt and space will redistribute pressure and help to reoxygenate the tissue. And we talked about adipose tissue losing its vascularity. And if we use tilt and space helps to reoxygenate the tissues. So tilt and space is an essential feature of bariatric seating. Vapor permeable breathable material. to reduce microclimate and moisture on the skin. Bariatric clients do tend to sweat more. So this is a very important feature, that they're not sitting on vinyl or material that's not allowing the skin to breathe. We need to ask ourselves when we're doing an assessment, is the client's weight stable? Are they maybe going to lose weight because of a regime that they're on, or are they going to gain weight because they're not maybe on a regime? Because that means an adjustable chair is going to be much more suitable for that person. So we can either bring the arms in, we can reduce the seat depth, we can change the chair to suit the changing needs of the patient.
Seating Matters, we are here to help you and your patients. So if you have a patient that you feel would benefit from what you learned today, you can set up a person-to-person demonstration or an online demonstration to view our products and put this into practice.